All right. Well, hi, Jason. Welcome. I'm so excited to have you here. Really excited about the partnership that Optimizely and Phase 2 have together. Would love for you to introduce yourself and talk to us a little bit about why you're here today.
Thanks so much. So I'm from Phase 2. Phase 2 is the digital experience agency for healthcare. We are passionate about the customer experience. We are grounded in data and insights, and we are rooted in 20 years of successful technology delivery. In my role, I serve as the principal strategist for data and insights, which means I advise our internal teams and our clients on trends and best practices and challenges in the first-party data part of the world, as well as privacy and compliance and anything that touches the customer data pipeline.
Awesome. Well, we at Optimizely are so excited about this partnership that was born at the end of last year when we became HIPAA enabled on our CMS and experimentation platforms. And I think the sky's the limit for us as we kind of talk about compliance when it is in the context of a DXP. Yeah. And one of the things that when we've kind of geeked out about this before today is it was really poignant what you said is compliance is something we get to do. And I'd love to hear more about your perspective on that.
Yeah, I mean, there's this idea of a compliance as being an obligation, like regulations, obligations that are sort of foisted on people from the outside. And I think that kind of thinking really limits what you can do strategically. If you change the frame and think about privacy and compliance as something you get to do, the notion that we should treat a person's data that they give to us with the same respect that we would treat that person, we reframe that conversation away from compliance as obligation, but instead toward really valuing transparency in data collection, really valuing privacy as almost like a brand value. Mm-hmm. For us, we found that really opens up strategic avenues, technological avenues, just new ways of thinking to help us solve these really challenging problems.
Yeah, absolutely. And I think we hear a lot about kind of patient access and the digital front door, but this also kind of sounds like it's dovetailing into something that's like digital bedside manner.
That's exactly right. Like we think about just in our personal lives, we go to a doctor. If it's the first time we're meeting them, they have just a few seconds in that first meeting to transmit expertise, make us feel at ease, and get us to a place where we can really quickly talk to them about the most important things that are going on in our lives. And that's bedside manner. Mm-hmm. Right? I think that there's an opportunity for us to think about the digital bedside manner. What can we do as communicators, as marketers, to take that same idea? What can we do to quickly engender trust for people who interact with us, who we are meeting for the first time? Not only in that first interaction, but in every interaction after that. So this notion of digital bedside manner, just to me, it really sums up how we should be thinking about the patient experience, the customer experience, and what can we do to just make sure we're always moving toward that.
Yeah, absolutely. Yeah. And kind of to what you said, this is, when you talk about a patient journey, it's one of the more personal journeys that anyone's going to go on as a consumer. Yeah. Because if you're buying something in retail, you have that journey. If you're signing up for an account at a bank, you have that journey. But the healthcare journey is typically anchored in a very trying, a very stressful, very scary time in someone's life. Yeah. And there is it's not just a personal, it's like an individual emotional journey that someone's going on. So what do you do to kind of reconcile, while compliance we're saying is not an obligation, but it's still something you have to take into account. How do you do that while still giving someone a personal journey on a web form or in a digital manner?
So we need to start by making that person feel at ease, so being transparent in data collection, being transparent about what we're doing. I think that's one place where we're talking about personalization and guiding that experience. In the e-commerce world, there's this notion that personalization should feel magical. Mm-hmm. It's like you don't even know that the experience is personalized for you. I think in healthcare, it needs to be flipped on its head. We need to pull the curtain back a little bit and say, this is what we're going to do. Do you want your experience personalized? Mm-hmm. Do you want your experience to be preferential?
Yep.
Be be really thoughtful and transparent about that in a way that we don't necessarily have to be when we're doing it for e-commerce. That engenders that trust. And then when we're personalizing, we're thinking about what kind of journey is the person on? How are we interacting with them? Are we in a place where we're in more of a delivery of care mode, in which case we do have their true personal information? They do want a hyper-personalized experience, right? I want my doctor to call me and say, for your 9 o'clock appointment, come to this building at this time, park at this place, come through this door, make sure you have these 3 things. Jason, we know it's you. We want that hyper-personalized experience in the delivery of care. But on the marketing side, I mean, at least personally, I'm not quite sure that I want that level of hyper-personalization.
Right. I don't think I do either.
Right? Like we think we do. But do we really? I think we want preferential. I want you to know the kind of person I am. I want you to be able to guide me through my journey. If you sense that I am potentially a patient, like change that experience around getting me to that booking appointment as seamlessly as possible. If you see that I'm not, people come to healthcare sites and for other reasons, for either they're a caregiver, maybe they're someone looking for a career, build that journey too. So I think that's really where the personalization comes in, that preferential journey is, are we in delivery of care? Are we in marketing and communications?
Yeah.
Splitting those things and then taking the person through the correct journey, really understanding their intent.
Yeah, definitely. And I think you're hitting on something that's really interesting, and it's kind of the evolution that we're seeing of the role that a website has for doctors and providers, where previously it was actually pretty anchored in academics, and it was about research, and it was about kind of the self-promotion of what they were doing in their actual medical innovation. But there's still digital innovation, and I think that's rooted in the fact that now websites have evolved to really be a tool for doctors to engage with their patients. So would love to kind of hear how we can drill down into more of the tactical, like when we're talking about personalization and electronic personal health information, how can we create these journeys and go through this personal, if not personal, preferential journey? How do we actually execute that? Or how would a healthcare marketer do that while ensuring the compliance and privacy standards are met?
Yeah, that's a great question. And I keep thinking about the distinction we sort of implicitly draw between of personalization inside the healthcare space and outside the healthcare space. And there's a myth that they're really different.
Right.
That seems to be one of the myths, like healthcare and personalization.
Just can't do it.
We just can't do it. There's so many rules. There's so much restriction. And I think that's, at least for me, the genesis of that myth is that in the non-regulated space, that e-commerce folks have deep dossiers on individuals, right? Like there's this—
The manila envelope,
right. It's like this, and in some cases that's true. There are some big tech giants who actually do know me as me, and they have personalized experiences that are based on all this third-party data and deep first-party data. But do they really? Right? I think outside of a few big players, even in the e-commerce space, those journeys are more preferential than personalized. And so the same things that most e-commerce do, I think, are available to healthcare, at least somewhere on that spectrum. So understanding behavior, understanding intent, looking at geography when we can look at geography. There, because of HIPAA, there are limits to how deeply we can understand a person's geography and use that to personalize. Just really good, I would say traditional website metrics around audience behaviors are available to us. Time of day is available to us. Understanding a person's intent for that individual visit.
Got it. Yep.
What kind of information are they looking at? Are they looking at more health condition related information? Are they more tactical and looking at, what's on the menu today at the hospital? Where
Got
where
it.
do I park? Sort of plan my visit information. Are they outside that patient experience entirely? And again, focusing on careers and the other things that a hospital system needs. There are a lot of avenues here for personalization. I think there are a lot of data points and types of data that are available to healthcare marketers and communicators. Right? They can be put to use. Yeah.
Yeah.
I think that the interesting thing is that with personalization, when we look at big segments of non-personalized data, we're still trying to draw those inferences to understand our own content. We look at things like time on page and dwell time and scroll depth and where do people click and how do people click as content strategists to understand how is this content performing. We can capture those same things at a more personalized level. So not just how is this content performing, but is this content resonating with Jason? Can we personalize it based on where he's dwelling, how much he's scrolling through, and then personalize that experience through related content, through changing the IA, through changing the UI a little bit. If you see I'm a career-minded person, maybe those patient avenues become smaller and the careers avenues become larger. There are a lot of things we can do.
Yeah, absolutely. And to that end, it's probably very overwhelming to organizations that are just starting out on this big transformation toward a more personal preferential experience for their consumers and their patients. So if you were to advise, how do you start? Which could be a very ambitious question.
But how do you start? I think there are two places to start, two things to do to start. First, involve your compliance and privacy team from day one. Because often marketers only talk to their compliance teams, communication teams only talk to their compliance teams when there's a problem or there's a big thorny question they have to solve. Right? And the outcome of that is that compliance sees marketing as this obstacle and that everything related to healthcare marketing is a compliance issue because they're only brought in on the big, hairy problems.
Yep.
So if you bring your compliance team in from day one, engage them in the process of getting started. First, they're going to be with you throughout and can advise not only on what the laws are, what the regulations are, but your particular appetite for personalization. Like, how do they see these regulations? They should be involved from day one so that they see that marketers are trying to solve big problems and small problems, and not everything is a fire. The second thing to do, there's this notion when choosing software of the crawl, walk, run approach. Like, let's just do a really simple thing first, and which is great in the way you should implement. But when people are going through the software selection process, their criteria are usually based on the crawl.
That's a very good call out. Yeah.
Your criteria should be based on the run. Like, what do we want to do in the very long term? Can this tool or this constellation of tools actually do that for us? And when thinking about whether those personalization strategies are going to be, like in that crawl, walk, run, remember that it's not just a tool that you're buying. In many cases, every piece of software has a point of view. Right? I think that's what makes software interesting, is that you're sort of, when you're buying the software, you're not just buying features. You're buying into a point of view. You are starting a relationship with a new partner.
Yep.
So those things matter just as much as the feature sets.
Absolutely.
Yeah.
Yeah. I'm with you on that one. And that's why we're so excited about this partnership here. Because I think it's the really nice marriage of tools, point of view, solving for business problems, and really driving toward a unified vision together.
Yeah.
So I do have kind of another left field question for you. Where do you see this going in the next 5 to 10 years? Because we obviously, while we're thinking about the near term, also have to be thinking about the long term. So from the personalization and the compliance standpoint, obviously, you have to implement future-proof solutions now,
Yeah.
knowing that it's going to evolve. So kind of where do you see that evolution heading?
Okay. That's a grand question. I think it's heading in 3 or 4 factors are going to determine where it heads, right? So one, state by state, there are more state-level regulations that are coming online every year. So the regulatory landscape is going to become more complex. That's going to drive, I think, a lot of decisions. The second is the continued rise of first-party data as important. I mean, we've been hearing about the death of third-party cookies like every year.
Yeah.
Right? This year is going to be the year that third-party cookies finally go away. And I've been hearing that 7, 8, 9, 10 years. But I do think we are on that path toward a more first-party driven world for lots of reasons, for compliance and privacy reasons, for budgets being sort of harder to justify. And so if we're able to have ownership of the data that goes into our marketing strategies rather than relying on that third-party data, kind of future-proofs our strategies. I think those 2 things are really interesting. From a technology standpoint, I think we're seeing sort of 2 big trends. On the DXP side, maybe a move toward more of a verticalized systems because you want your content flow, your your content supply chain, as you call it, like to
Our favorite.
to live inside of a single system. On the other side, though, on the data side, I think we're going to see a move toward more composability, especially with organizations who they already have their own data warehouse, they already have their own data lake, they already have their sort of core plumbing and data infrastructure for that kind of collection. So I think we're going to see more composability on the MarTech side that's going to be sort of built around a foundation of a bring your own data warehouse, and then other tools are going to attach to it. Those are the things we're probably going to see over the next few years.
Very cool. Yeah. And I think there's so much room that Optimize Lean Phase 2 have in that transformation of the journeys for the patients, of the journeys for the organizations, of this kind of technology boom. So I would love to just ask you kind of what are you most excited about with this partnership? Where do you see the biggest opportunity for us and our potential partners out in the wild?
Man, I see a place where we have the sort of best of a technology solution paired with the best of strategic thinking, and both with a history and a proven track record of solving hard problems. I love solving a good hard problem, right? That's what makes me most excited, to bring together people who we know have proven track records, who solved that before, I know how to solve that again. And for me, that's really exciting to know that we are partnering with people who are as passionate about it as we are and as skilled at delivering as we are.
Awesome. Well, I think that's probably a very solid note to end it on. These studio lights are getting hot, but really, really appreciate the time today, Jason. And I think that this has really opened people's eyes to the fact that you can deliver a very personalized journey while also being within the scope that you need to make your compliance team happy. And I think you nailed it when you said that it's 2 companies coming together that have proven track records of execution, of expertise, and really excited to see what we can do together in 2025 and beyond.
Thank you so much. Thanks for having me.
Yeah, this is fun. Thank you.
All right.